Hi, Miss Beermeyer. My name's Lauren, and I'm going to be your nurse today. How are you feeling?
Good.
All right, good. Well, I'm going to do a little mini assessment on you. I'm going to take a look at your entire body, listen to your lungs. If you're ever uncomfortable or feel any pain throughout any of this, just let me know.
Okay.
All right, I'm going to check your fan. Can you tell me your name
Lauren Beermeyer,
and your date of birth?
9688.
Good. I'm going to start out by taking some of your vitals.
Okay.
And just remember, if you have any discomfort, just let me know.
Okay.
We're going to get your temperature. I'm going to get your blood pressure. Go ahead and check your heart rate. Can you tell me where you are?
At the Medical Center in Little Rock.
Can you tell me what day it is?
Thursday.
Good. Can you tell me why you're here?
Getting a physical assessment.
Good. All right, I'm going to check your blood pressure. Good. 102/68. I'm just going to feel your head. Make sure that we don't have any abnormal masses. Good. Facial features are symmetrical. I'm going to take a look into your eyes with my pen light and assess your pupils. Good. Can you read my name on my name tag for me?
Lauren.
Good. All right, now I'm going to have you just follow my pen with your eyes. All right, and now just stare at my pen. And then tell me when you can see my finger. I can see. Okay. Down the other side. Good. I'm going to have you close your eyes for me. I'm going to place something on your face. Tell me where you can feel it. few facial features for me. We're just checking all of your cranial nerves with a bunch of the tests that we're doing, just making sure that they're all intact.
Okay.
Can you smile for me? Frown, and then puff out your cheeks. Good. I'm gonna give you something to taste. And I want you to tell me if it's sweet, sour. So I'm gonna have you close your eyes. Alright, I'm gonna place it in your mouth. Can you tell me what that tastes like?
Peppermint.
Good. I'm just assessing you to swallow.
Oh, okay.
Now I'm going to give you a couple of things. I'm going to tell you a couple of words, and here in a few minutes I'm going to have you repeat them to me.
Okay.
So, tongue, nurse, hospital. And by the end of this assessment I'm going to have you repeat those, so remember those. Tongue, nurse, hospital. Alright, after you finish with that, I'm going to take a look in your mouth and make sure we don't have any kind of lesions. Teeth look like they're all proper. I'm going to check your tonsils and make sure that we're not swollen. Okay. Have you opened your mouth for me? And look in the back. Tonsils are pink and not enlarged. I'm now going to go ahead and assess your carotid arteries. So what I'm going to have you do is I'm going to feel one at a time, and then here in a second I'm going to listen. I'm going to have you hold your breath while I'm listening. Good. And on the other side. Good. Take a listen. So I'm going to have you hold your breath for me. Good. Take a deep breath. And then hold your breath again. Good. Now I'm just assessing, making sure there's no kind of breeze or there's no kind of thrill sound going on, flushing. You're not supposed to hear that. Alright, I'm going to go ahead and take a listen to all of your heart sounds. I'm going to listen in 4 or 5 different places. I'll name them off as I'm doing them. Just tell me if you're uncomfortable at any point. Aortic, pulmonic, herbs, tricuspid, mitral. And then one more time. Aortic, pulmonic, herbs, tricuspid, mitral. I'm going to assess a couple of your pulses and check for edema, making sure we're getting proper circulation. I'm going to check both of your radial pulses. Good. Pulses are 2, strong, and equal. Just going to check your popliteal. Okay. Pulses are strong, equal. And then take off your socks. Okay. Just your pedal pulses. pulses are too strong. I'm just checking your capillary refill. Good. Capillary refill is less than 3 seconds. Now leave your socks off and just cover. Okay. Now I'm going to check your hands. Capillary refills less than 3. Throughout the entire time, I was also assessing your arms, your hands, noting if there was any edema, and there's no edema noted on either side. No edema. Alright, what I'm going to do now is check for some jugular vein distension. I'm going to have you just lay right here. I'm going to lay you back just a little bit. I'm going to have you look slightly to your left, about 45 degrees. Alright, good. To the front. Head just slightly 45 degrees. Good. No jugular vein distension noted. Now we're going to go ahead and do your pulmonary exam. I'm going to take a look at your chest, watch you breathe, see if you're having any labor breathing, because any signs of acute distress are going to be rapid breathing, shallow breathing. If you're diaphoretic whatsoever, if you have a high heart rate, and we've had no problems yet, I'm just going to make sure that we're not having any others. I'm also going to do a lot of listening to hearing this. Okay. All right. So chest. Respiratory rate is unlabored, symmetrical, and trachea is midline. What I'm going to have you do now is I'm going to have you sit up and face me. And if you could just throw your legs off the side of the bed, I'm going to go behind you. And I'm just going to check lung sounds, thoracic expansion, and for crepitus. So maybe take a deep breath in. Good. And take a listen to your heart, or to your lungs. Breath in for me. More time. Good. Alright. I'm now going to touch you and I'm just going to have you say 99 every single time I touch you. I'm just checking for any tactile firmitus. Alright?
99. 99. 99. 99. 99. 99. 99. 99. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99,
going to do the same thing again, but I'm going to have you sit up when I do a couple of them.
Okay.
You can lay back one. I'm going to go ahead and listen to your lung sounds in the front. Good. Your lung sounds were clear bilaterally in both front and back. I'm now going to have you just take a deep breath for me. One more. Good. Thoracic expansion was equal bilaterally as well. I'm going to have you sit on the side of the bed facing the other way. Now we're going to go ahead and listen to your heart sounds while you're sitting up. Aortic, pulmonic, herbs, tricuspid, mitral. One more time. Aortic, pulmonic, herbs, tricuspid, mitral. Again, we're going to do the 99. I'm going to assess to the front.
99, 99, 99, 99, 99, 99, 99, 99.
Good. Do a little percussion. Good. You can lay back in bed. I'm going to lay you back now. I'm going to take a look at your abdomen. I'm just going to uncover your stomach a little. Stomach is flat and non-distended. I'm now going to take a listen to your bowel sounds. Good, you have very active bowel sounds. Just going to feel on you, tell me if you have any pain and you're uncomfortable. You have no masses. What we're going to do now is just a little bit of range of motion. I'm going to assess your strength, range of motion. I'm going to have you get out of bed and go ahead and assess your gait. We're going to do full musculoskeletal. Just tell me when you're up high enough. That's fine. squeeze my hands on both sides. I'm just assessing that they're equal and strong bilaterally. Good. All right, can you put your hands out to me? Now push against me. Good. Pull back. Good. We're going to do the same thing with your feet. Can you push down? Pull back. Good. I'm going to go ahead and test your clonus reflex. Just relax your foot. Good. Good. We're going to go ahead and do just a little range of motion with your legs. I'm just going to have you bend your leg up. Good. And out. Good. Now the other side. Good. And out. Good. I'm now going to assess the range of motion with your arms. So I'm going to have you lift your arms up and back down. Open to me. Good. Now the other arm. Back down. You have full range of motion, no weakness, no limited movement. I'm going to have you sit on the side of the bed. I'm going to just go ahead and take a test a few of your reflexes. We've already done your clonus, so I'm going to check your brachial reflexes. I'm just going to have you relax your arm. Just going to have you just relax it. And good. Now the other side. Good. I'm just going to have you step out of bed and take a few steps for me so I can go ahead and watch you walk. So can you walk to me? Turn around. And then back to the wall. Good. Alright, you can get back in bed. Your gait was steady. There was no abnormalities. So throughout this exam, I've been assessing your entire body. I've taken a look at your skin from head to toe. Your skin had no abnormalities. There was no noted redness. That was anything that was not normal for you. I didn't notice no lesions throughout the entire exam, no masses. So what I'm going to do now is I'm just going to go ahead and check your skin tone. Just making sure we've got good recoil. I'm going to just check over top of your feet. You had rapid recoil. Throughout this entire exam, we've also done all of your cranial nerves 1 through 12 by having various different things that I've had you do. The last thing I'm going to have you do is, can you remember the 3 words that I've given you?
Tongue, nurse, and hospital.
Good. All right, I finished your head to toe exam. There was nothing abnormal that I normally wouldn't expect to see. If you have any questions, just call me back in here, but I'm going to let you get some rest.
Okay.